Hi, everyone. I'm so excited to speak to our very lovely guest today, Sushrusha Arjyal, and she is calling in from North Carolina. And I'll let you introduce a little bit more about yourself and who you are and what you do. So take it away, Sushrusha.
Okay, hello. Thank you, Dr. Segal, for having me here. And I am a psychiatrist and a sleep specialist. I live in North Carolina.
Yeah.
Previously, I was at Duke University Hospital in academia, and I decided to explore the private practice world. So
Mhm.
here I am. I'm the owner of Bliss Sleep and Psychiatry, and my practice is like what, 12 weeks old,
Oh,
12
wow. It's a
13
little
weeks old.
baby.
Yes. It's my baby.
Very nice. So tell me what made you want to leave and start your own practice and focus on sleep and psychiatry?
I had never ventured in the private practice world.
Yeah.
So I just wanted to explore and see how things are there, and also learn. You can never stop growing and learning. So, like, I mean, we were discussing a little bit before this, right? I
Yeah.
love meeting new people. So I love, like, meeting physicians, psychologists, other healthcare professionals, people who are not in healthcare,
Yeah.
talking about, how in some ways we can contribute to the change, in medicine, and how
Mm.
we can really be up to date as physicians, also, and how to, most importantly, how to make it safe and easily accessible for patients.
Yeah. Wonderful. And so you focus mainly on sleep in your private practice, and tell me what drew you to the practice of sleep in the first place?
So the name Bliss,
Hmm. Yeah.
blissful. So I want people to have blissful sleep.
Yeah.
Uh, so one of the things that kind of stood out to me when I was doing my fellowship, or even a little bit before that, when I was doing sleep elective, right, is psychiatric illnesses and sleep disorders they go very much hand in hand.
Hmm.
So you cannot treat one in isolation and not treat the other. That was one of the main reasons why I did sleep fellowship, because I wanted to treat all together.
Yeah.
If someone is suffering from bipolar disorder, they are very likely to have insomnia.
Yeah.
If someone has post-traumatic stress disorder, they are very likely to have disrupted sleep because of nightmares, because of all of that.
Hmm.
Now, if we talk about, like, sleep disorders like obstructive sleep apnea, people with obstructive sleep apnea can have, you know, less energy. They can be fatigued. They can be disinterested. All of which can contribute to or lead to symptoms of depression.
Yeah.
So these are not like two different. I don't see them as two separate problems.
Yeah.
Actually, I see them as problems that need to be tackled almost at the same time. So that's what brought me here. And what I do in my clinic is general sleep evaluation, general psychiatric evaluation, medication management, therapy, sleep studies, cognitive behavioral therapy for insomnia, all of them above.
Yeah. Yeah, it's interesting because I remember when I first started kind of diving into sleep and learning all about how, the science behind sleep and how sleep can affect the body. And I remember reading something like, if you just get like half an hour less sleep, your anxiety goes up by like 25 or 50%. Like it's just like a tiny bit less sleep than you're supposed to get. And the anxiety levels just go up. And I found that really fascinating, how connected just a small bit of sleep loss is connected to our mental health.
Absolutely. That, and sleep is related to anxiety, to our all sorts of mental illnesses, and then to our physical illnesses, right? People who don't sleep adequately,
Yeah.
meaning less than 7 hours consistently,
Yeah.
they are more likely to have cardiovascular problems.
Yeah.
They're more likely to develop dementia over time.
Yeah.
They are more likely to, in some ways, like have overall very, deteriorated like physical health and mental health.
Yeah. Yeah, it is fascinating. Like, and I think very underappreciated by most people about how it can affect, our blood sugar control, our weight management. It's all linked to sleep. So, I actually consider sleep sort of like the base of sort of the health pillars. Like that's the number one thing that needs to be fixed. And it's just about awareness for people and people actually, well, one of the things is, first of all, this is the way I look at it, is just at least giving people an understanding of how important it is first. And then for some people, once they kind of realize it, then and can appreciate it, can kind of focus on making sure they get that amount of sleep. But then for others, as you said, if they have a sleep disorder, or, if they're undergoing perimenopause or having other things that kind of factor into their issues with sleep, then of course they might need more support in different ways. Is that what you found, or what have you
Yeah.
found?
No, it's very interesting that you mentioned the metabolic part, right?
Hmm.
So when we were doing board certifications, we used
Yeah.
to, there are things like you memorize, right? So we used to remember there's a hormone called leptin, right? And there is something called ghrelin,
Yeah.
GHRELIN. And we used to remember G means obese, L
Okay.
means lean,
Oh, that's funny.
you
Funny way
know?
to remember those two. Yeah.
Yeah,
Because
yeah.
ghrelin gives leptin helps you gives you that
Yes.
signal that you've eaten enough and stops you from
Yeah.
eating, where ghrelin doesn't, like, you continue to
Exactly.
eat, right?
Exactly. So ghrelin makes you fat and leptin kind of gives you the feeling of satiety and makes you then lean.
Yeah. Right.
When people sleep well, leptin goes up and ghrelin goes down,
Yeah.
you know? So
Mhm.
that also kind of is very fascinating that
Yeah.
way.
Yeah.
Yeah.
Yeah. There's
So
so much metabolic and hormonal things that happen when we sleep, hey?
true. And, when we look at like sleep in pregnancy, menopause, right, perimenopausal phase, a better sleep actually leads to better care of the baby also.
Mm,
Less chances of going into postpartum depression,
yeah.
less chances of, anxiety. So it affects overall in every phase of our life, really.
And what is your approach when someone comes to you with some issues with sleep?
Yeah, so one of the things that I do is the referral can be for sleep study or can be for sleep evaluation.
Mhm.
But then again, I do a very detailed history
Mhm.
to see what else is going on. And sometimes, it's so interesting, like when you take that history and, okay, what are you doing? Why aren't you sleeping? Dr. Arjyal, I have 5 dogs. Comes in like third, fourth, fifth session.
Right.
Okay, and are you worried about them? Yeah, one of them is really old, and so the power of good history, right? I keep on saying this in my different, like,
Yeah.
podcasts and different talks that I give, is I start with a good history. I do not rush.
Yeah.
I would say, okay, let's talk about it. And if one session is not enough, let's talk more about it. Because unless I really know what's going on 360, there
Yeah.
is no way you can treat sleep.
Yeah.
It's hard. You have to know the relationship with the spouse. You have to know if the spouse has sleep disorders, could have.
Snoring.
Exactly, exactly. So if the spouse is snoring heavily and
Yeah.
the bed partner is most likely to develop insomnia over time.
Yeah. Yeah.
That, and there are so many other sleep disorders, right? Like people could be acting out in their dreams, people could be using alcohol and other drugs,
Mhm.
people could be sleepwalking, getting up and eating in their sleep.
Mhm.
So a lot of those factors. So what do I do is I do a detailed history, then I send patients for sleep study. Send meaning like we do it in my clinic, but like we do the orders and all that. And then I sit down and I talk to the patient, and then I do psychiatric evaluation if needed, not in everybody, but if I feel like it's just, overlapping, then treating anxiety during the day can help with your sleep. So they just are very, embedded.
Yeah, interesting. So what have you found the most surprising in terms of treating people with sleep so far on your journey?
The most surprising that I have found in certain cases is how the patients how nobody has asked that question. Because see, I'm a sleep specialist and a psychiatrist, right?
Yeah.
And there are not very many, like, because psychiatry is a specialty in itself, and
Yeah.
people tend to explore, and there are so many other things that you can do after, like
Yeah.
you can do, CL and other fellowships. So
Okay.
what I mean, what I'm getting to is, when I get patients, they have been through, most of the times, through their primary care and few other people,
Yeah.
and there have been cases where I'm like asking them, okay, do you drink caffeine? Like, how much caffeine do you drink?
Yeah.
Why aren't you not sleep? Why aren't you sleeping? They would be like, yes, 10 cups a day. And
Yeah.
I am not making this up.
Wow.
And I said, so do you know the half-life of caffeine is like, about 5 hours, and you were not supposed. Nobody told me that.
Really? So they'll have like seen a bunch of different people about their sleep issues, and then you uncover that they're drinking 10 cups of coffee a day.
Yes,
And they
yes.
never heard, wow, that is surprising.
And it is very surprising, because I call it this is the age of information, right? People know
Yeah.
a lot.
Right.
Those have been cases, or in some cases that people were regularly consuming very high amount of alcohol, and that never came up.
Wow.
Never came up.
Yeah.
So how are you managing? I
Yeah.
mean, I could probably go on and on, really.
Yeah.
But, so that's why I believe in spending time with the patients, taking the
Yeah.
history, and even then things might get missed, right? I'm not saying
Yeah.
it's 100%, but it is actually helpful, because those are small interventions then.
Yeah. Which make a huge impact, right? So
Absolutely.
just kind of talking to them, getting their real story, finding out the little details. You can find the one detail that will make a huge difference if it's just uncovered.
Absolutely, absolutely. And the current stressors, right? If someone is, suppose, again, like going to their sleep pattern, has a very delayed sleep phase,
Yeah.
goes to bed late and wakes up late, but has to report to work like at 6 a.m. Of course, they are not sleeping, because they'll get up at 3 a.m. and wait until 6 a.m. because they are too afraid that they would sleeping.
Right.
But these patients don't have insomnia. What they have is delayed sleep phase syndrome, a circadian rhythm disorder, which
Right.
needs to be addressed a little bit differently.
Yes. So first of all, figuring out what the actual problem is, and then figuring out a way to adjust it or fix it.
That's correct. Yeah, yeah.
Interesting. And so if you, for our listeners out there, if you wanted to give them, a couple pieces, like pearls, pieces of advice, if they're kind of having issues with sleep, or what would you say to them?
So one of the most important things is, people think when they are not sleeping, they need to stay in the bed. They can't get out of the bed.
Right.
It's quite the opposite. So if you don't, so lesser time you spend in bed when you're not sleeping, the better you sleep. Meaning, if you don't get sleep, please get out of the bed. Read that good old book. Don't use electronics, and let the sleep come to you. Don't chase your sleep. So that's something that I'd say. And one of the questions that comes up very frequently is, should I track my sleep? That would depend on sleep specialist, I guess. But this is my personal experience, and has been my experience in the clinic, is it makes people anxious.
Yeah.
There is an use, like, if you can, like, there is a use of tracking your sleep if it has been recommended by your doctor while you're doing a therapy, like cognitive behavioral therapy for insomnia. But otherwise, just tracking is not very helpful, because there's this, like we used to say, if you are not sleeping for 4 or 5 hours, you're not sleeping.
Yeah.
So in some cases people tell me that it's validating for me if I see the stages and all that. If it works for you, great. But if you're suffering from anxiety and insomnia already, it's better not to track and to get the help that you need.
Yeah, that's good advice. And that's a good thought, actually, because I did have a tracker for a while and it broke and I haven't replaced it just yet. But I was kind of wondering, should I replace it? And at first it was sort of the same idea, like, well, I kind of know approximately how much sleep I'm getting. Do I really need to track my sleep? And yeah, I think I'm still on the fence, not really sure if it added value or not. But definitely, if you're a person who tends towards anxiety and will get more stressed if they see, oh, I didn't get the deep sleep I needed last night, or oh, I had like 5 awakenings, then it's probably not as helpful for you.
Yeah.
I've heard that some people say, like, if you're going to do an intervention, though, then sometimes it's good to see, is that intervention working? So you can kind of just see the before and after. So sometimes it's helpful for that. But
Yes.
but yeah, I think overall, is the value, is it worth it or not?
Yeah, I mean, any kind of labs, right? We have to know what are we going to do with the results
Yeah, exactly.
beforehand. If I'm ordering anything, right? Even for like any other labs, if I'm ordering blood work, I know what I want to do with the results, right, with your patients. And so that's why I am a little too, I personally don't track my sleep ever. I have never done that.
Right.
I don't track my steps. I just walk.
Yeah.
Yeah.
Yeah, so I think that's good, a good approach, in terms of like whether or not you're going to do something with it, whether, like, what's your personality like, if if it will encourage you, if it will discourage you, and usually, as you said, you kind of know if you're getting enough sleep or if you're getting enough exercise, right?
Yeah, true. And with the sleep, the most important thing is your body will tell you.
Yeah.
If someone wakes up feeling rested, has energy to go about the day, you most likely are sleeping very well.
Yeah, exactly. That's why we say, do you feel rested first thing in the morning? And if you are, then you're probably doing okay.
Yes.
I have a friend who can actually, she can get a little bit less sleep than most people, but she feels fine in the morning. So I said, well, then you're one of the, I think it's like 5% or something of people
Yeah,
that
short
need.
sleepers.
Yeah.
Yeah.
I'm
Yeah.
like, well, that must be you, because I could not feel as good as you do on that amount of sleep.
True. And see, and that's a great point. In that context, like that person does not need an intervention.
Yeah.
Actually, that might be detrimental if we put them on
Yeah.
sleep medications or,
Right. Yeah,
So,
exactly. Yeah. So that's, yeah, interesting. Okay, well, just before we close up, maybe just share with the audience, like, how your life has kind of transformed over the last little bit with your shifts in your career and your shifts in approach. How has that shaped you and your wellness?
I'm feeling very grateful.
Hmm.
Gratitude is perhaps the first thing that comes to my mind when someone
Yeah.
asks me this question. I feel like I'm at the point of my life where I prioritize self-care more
Hmm.
than anything else.
Yeah.
I love time with my patients. I love time with my family, time with nature.
Hmm.
Um, and in the last few years, what has changed is self-care.
Hmm.
I've really prioritized, like, exercise, healthy eating, all
Hmm.
of that, and very mindful sort of
Yeah.
mindful living, so to
Mental
speak, and,
living.
and
Yeah.
and a grateful living. I'm very grateful for what I have, found in life in terms of friends, family, profession,
Yeah.
and I look forward to really also sorts of developing meaningful relationships, and making it count, right? Making every moment count.
Yeah. That's
Like
wonderful.
we're making it count right now.
Yeah, exactly. And I love that. And yeah, just having that like those positive emotions of gratitude and living in alignment with, your purpose and your values.
Absolutely.
Yeah.
Absolutely.
Well, thank you so much. So, how can the listeners find out more about you and what you do if they want to learn more?
So my website, blisssp.com.
Yeah.
My practice is Bliss, Sleep and Psychiatry. And you could email me. It is a secured email. You could leave us a voicemail. You could approach us in so many different ways.
Great. Well, thank you. And I love the name of your office.
Thank you. Thank you very much. You're very
Well, thank
kind.
you. Thank you so much. It's been great chatting with you, and love to hear how things are going down the road. So for sure, we'll need to keep in touch.
I'd love to. I'd love to. Thank you for having me.
Thank you. Bye.